Disinfectants are essential in a dental office because they play a crucial role in preventing the spread of infectious diseases and ensuring the safety of both patients and dental professionals. Here are 5 do's and 5 don'ts to keep in mind when using dental disinfectants. Do 1. Make disinfecting more convenient by using wipes over a spray. Dental wipes are fast and convenient to use, making it easy to disinfect your equipment between patients. 2. Always wear proper personal protective equipment or PPE when using dental wipes. The use of PPE ensures that dental professionals are protected from potential exposure to the disinfectants, reducing the risk of irritation, skin sensitization, and respiratory problems. 3. Choose the right chemical. Dental wipes come in a variety of chemicals like quaternary ammonia compounds, hydrogen peroxide, alcohol-based, and even chlorine-based. Each of these disinfectants has its own properties, advantages, and limitations, and the choice of the disinfectant depends on the type of equipment, surfaces, and instruments that need to be disinfected. Choose the right contact time. In dental practices, where many patients are seen throughout the day, time is a critical factor. Using a disinfectant with a fast kill time can help dental professionals optimize their workflow and reduce the time spent on disinfection procedures. Use enough wipes. Use enough wipes to adequately wet each surface for the proper contact time. And this can be tricky depending on many factors. The sun coming in from a window or the heat being on in the office. This could dry the surfaces faster than the kill time needed to properly disinfect. Now let's move into the do nots. 1. Do not skip the second disinfecting wipe. Disinfecting is a 2-step process. The first step is to clean the surface or equipment to remove any visible dirt or organic matter. The second step is to apply the disinfectant to the surface or equipment, ensuring that all areas are adequately covered and that the disinfectant remains in contact with the surface or equipment for the required contact time. Don't forget to read the instructions for use. Always read and follow the instructions for use to ensure that the product is being used correctly. For instance, do you know the contact time for the cleaning step and the disinfecting step? Or if the disinfectant can be used for both steps? If not, the instructions for use will guide you. 3. Don't place barrier wraps until the surfaces are dry. The surfaces need to stay wet for the proper contact time, and barrier wraps and items should not be placed on the surfaces until they have dried. Don't leave the lid open on the container. Always make sure to close the lid on the container to prevent the wipes from drying out. This will help you ensure you have enough liquid to keep the surfaces wet for the entire contact time. 5. Don't mix multiple types of disinfectants. Disinfectants should not be mixed or used together because it can cause chemical reactions that can reduce their effectiveness, damage surfaces or equipment, or create harmful byproducts. Mixing disinfectants can also create health or safety risk for dental professionals, patients, and anyone else in the vicinity. Overall, disinfectants are a critical tool in maintaining a safe and healthy environment in a dental office, and dental professionals should follow established protocols. By following these do's and don'ts, you can ensure that you are properly using dental disinfectant wipes to protect yourself and others in your dental practice. Henry Schein provides a variety of wipes that meet industry standards for optimal safety and hygiene. Explore our selection now.